Creaky, cranky, push beyond their capability, skateboarders' knees. What's going on, guys? Danny from Skateboard Strength, and after having posted this video that's amassed over 18,000 views, I have since gone on to help hundreds of skaters worldwide, from your pro and sponsored skaters all the way to your everyday battler, overcome their skate-based knee pain. And today, I'm not only going to show you the most common mistakes skateboarders make when navigating skate-based knee pain, but also I'm going to give you a program to make skate-based knee pain a thing of the past.
Front salad, back salad, front blunt.
I think what would be incredibly important is to first begin with a little bit of education around the knee's role in skateboarding. We do this not just so you can begin to understand why you're experiencing knee pain, but also to help you avoid continuously falling into the same pitfalls that most skaters and fucking practitioners continuously fall under, not allowing them to recover. This will also help you understand why this program and approach is so different to what's out there and will set you up for maximum results. The poor old knees cop a brutal beating in the daily life of a skater, mainly because their roles of flexing and extending are seen in basically anything you're ever gonna do on a skateboard. Added to this, issues in weakness and instability further up and down the chain can have a massive effect on the knee's overall health, performance, and function. When we think about knee pain, it helps to break up their parts into two different categories: function and structure. Function is largely based on the muscles in and around the knee that help support its movements. For example, the quadriceps' main function is knee extension, which is relied heavily upon as we try and generate power from our pop phase by extending the knee straight. The opposite side movement to this would be knee flexion, which is predominantly done by the hamstrings. This is relied heavily upon in skating as we go to engage into our push stride to get some power. What's important to note is that these muscles do not work in isolation, but in fact assist each other's movements. For example, in order for the quadriceps to contract and to extend the knee up to produce power for our pop phase, the hamstrings must lengthen in order for it to do so. In this process, it is also providing stability at the knee. As we land our tricks or take impact, the quadriceps will be lengthening as the hamstrings are contracting. Both of these working in synergy together allow deceleration of forces to happen when you take an impact and take loading away from the knee joint itself. Their strength and ability to perform these movements is often what's going to take loading and forces away from this other category of parts at the knee that we're now going to look at: structure. When we look at structure, we are looking at the parts of the knee that are passive. They move or lock out depending on the positions that the function muscles are putting the knee into. Examples here will be the cartilage and the meniscus, and for simplicity and understanding sake, we're also going to throw the ligaments of the joint in here, which will include the ACL, PCL, and the MCL. Basically, these guys do not contract to move the knee, but rather rely on the function muscles to put their knee in positions where they will be used or relied upon. It's important to grasp this concept because whilst we might get diagnoses of ACL or PCL tears, there's nothing that we can do to specifically target these parts in the rehab process. Rather, we need to strengthen up the function muscles that aid the knee's movements and stabilize it so that the structure can not only finally begin to recover, but also stop taking so much unnecessary loading. For example, the role of the ACL and PCL is to stop the femur or thigh bone and the tibia or shin bone from moving away from each other, creating a dislocation of sorts. What most people miss is due to the insertion points of the hamstrings and the quadriceps, they actually help aid in this process as well. Meaning if the hamstrings and the quadriceps are strong, they actually help take a lot of loading away from the ACL and PCL. And is actually why we are now seeing a lot of people begin to rehab ACL and PCL tears without surgical intervention. Now, we briefly touched on this, but it's important to know. The knee is the mediator between two massive joints. Not this kind, but this kind, the hips and the ankle. Because the knee is sandwiched in the middle, the strength, stability, and performance of the hip and ankle greatly affect the performance of the knee. Here's some examples. If the hip is weak and unstable, it can force the hip to drift out to the side, particularly when we engage in things like our push stride or as we land our tricks. Now, as the hip drifts out, it's going to force our knee to buckle in. While some knee valgus is within normal range, an extreme buckling in of the knee can lead to irritation over time. This can come in the form of meniscus irritation due to the joint shearing taking place from being constantly placed in this position, or ITB irritation from constantly being tugged on in order to try and snap the knee back into position. For those that suffer quad tendon or jumper's knee issue, the sole focus is usually quadricep strength, and rightly so, it's an important piece of the puzzle. However, what is not often addressed is the Achilles tendon's role in absorbing load and impact will greatly affect how much loading gets referred up the chain to the quad tendon. With just a few of these examples, you can begin to see why the knee takes a brutal beating in the daily life of a skater, but also why hyper-focusing on the single area and not taking the big picture approach just ends in frustration with skaters believing that they can't fix their skate-based knee pain. It's also important to note that no knee pain is created equal. You can have two skaters with the same knee injury, give both of them the same exercise, and one will respond really well, whilst the other will come back with irritating symptoms. This is why there is no best exercise for knee pain, and why so many people get led astray trying to find this on the internet. What we need to do is build a system that allows a skater to find an entry point of loading that's good for their level of knee pain and their injury, and most importantly, bridges the gap from where they are to a smart runway of progression of exercises to where they need to be back to skating. And here is another place where most knee-based programs for skaters go wrong. Not carefully exposing the skater to dynamic loading before they return. They do all the exercises, get them out of pain, but then skip the dynamic loading and the exposure to the type of forces they will receive when skating and send them straight back on board. This inevitably just ends in tears because the skater hasn't built that tolerance and they have to take time off shortly after return. And this is what we aim to do here today. To not only take the time to fix your skate-based knee pain, but also take a step back, ensure we fix the underlying issues, and then bridge the gap between irritated knee pain and performance when skating. Let's get started. Before we do, if you enjoy this program and want it in an easy to use app with full video demonstration of each individual exercise, as well as ongoing support and a bunch of gems and different phases that allow you to not only accelerate results, but also improve your performance, be sure to check out the knee pain program by Skateboard Strength, link in the description. These mobility modalities are here to provide some relief to the current levels of knee pain. Most importantly, they provide a window of opportunity with diminished levels of pain for you to go and do the work that follows. So whilst you may feel some relief from this initial phase, be sure to continue to follow through with the work that is truly going to make the difference. The stability exercises are where we begin to address the joints and muscles that can have a great effect on the knee's ability to create stability. The strength built in these exercises will put the knee in a good position to not have to be overworked in attempting to compensate for the lack of help from the other joints or muscles. This is where we begin to build strength at the knee in its most vital functions and restore it back to working order. We'll begin by trying to find you a version of this quadricep isometric exercise. Here, choose the variation that best suits your current pain levels. We start here because it is a gentle entry point of loading for the knee, and studies have shown that isometrics can provide an analgesic effect on the pain levels received, meaning their use can down-regulate the signal of pain you currently have and allow you to finally be able to begin loading that knee again. This is also one of the best entry points of loading for quad tendon pain sufferers. If this is you, it is highly recommended that you take a session or two stopping at this point before continuing on in order to first build some tolerance. From there, we move on to our lunge variation. What you will see is a progressional route that sees you starting with a safe yet impactful way to load the knee, which then begins to challenge it over time by increasing instability and range of motion. What is important to note is at each stage, take the time to add load before moving to the more difficult variation. Do not progress for the sake of achieving a harder variation if you are simply attempting these at body weight. True mastery is not only ability to tolerate the variation, but to also tolerate adding load. Finally, we now use the hamstring curl variations to train the unsung heroes and often neglected when fixing knee pain, the hamstrings. Again, here, choose the right variation for you and your current level and look to progress once you can hit the rep ranges given. Finally, we have the piece of the puzzle most people miss when rehabbing their knees for skating: dynamic loading. Before attempting this section, it would be best practice to have spent some sessions doing the rest of the program on its own. It will also be advised that you are relatively pain-free before you attempt the dynamic loading section. When you are ready, this is how you'll do it. There are 4 layers to the dynamic loading section: pogos, oscillating squats, oscillating lunges, and reactive catches. Simply do 1 layer at a time per session. If you pull up okay the next day, you can attempt to add the second layer the following session, and so on and so on.
You can either like complain or you can skate.
And that's it. You now have a program that not only meets you at your current level of irritation and pain at the knee joint, but also allows you a good runway of progression of exercises to get you back where you want to be: skating. Most importantly, it aims to keep you there for good. Do this program 3 to 4 times a week, preferably with a day's rest in between. As always, please hit the like and subscribe button so I can continue making these for the skate community and share around with the homies in need.